Dr. Birx, I know I have a limited amount of time. I want to begin with this. COVID hospitalizations in North Texas, they just hit a record, more than 3,000 for the first time on Sunday. That's a 97% increase here since November 1st. What do you think about the coronavirus response in Texas?
I'm just really pleased that the governor kept those gates in practice and his policies so that when counties increase their cases, they go into a mask mandate. They go into restricted indoor dining, restricted bars, and really telling the Texans that they have to change their behavior. Texans right now have to change their behavior. We have to stop the spread within Texas. You can see what's happening in Dallas. You can see what's happening across Texas. What happened in El Paso can happen in every city in Texas. No one is different. They need to mitigate and they need to be vigilant and they need to stop the spread of this virus. We know what to do, but right now, with the way the cases look in Texas, we need to stop it now. And I know it's tough in the holiday season. I know we're asking people to make sacrifices. We are asking you to make sacrifices until we can get your beloved grandparents, aunts, and parents vaccinated. We know now that they're going to be in tier A, B, or C, majority of them, and we can hold on until we get individuals vaccinated and save as many Texans as we can.
And Dr. Birx, it's my understanding that the first wave of the vaccine, and it's the understanding of many, that the first wave of the vaccine is for healthcare workers and those who live in long-term care. Why is it today that Texas Governor Greg Abbott's getting the vaccine, as well as we've seen President-elect Biden and other political leaders?
I think they're trying to make it very clear from the American people. And that's why they've gone on TV to get it. They haven't gotten it secretly. They've gotten it in public so they can show that needle goes in your arm and nothing, they're fine. And I think that will really help reduce vaccine hesitancy. I think the more bipartisan individuals who get this vaccine to show that leadership is really critical at this time. I want to thank the healthcare workers who have stood up to get this vaccine. They know how efficacious it is. They know this is going to prevent them from getting serious disease. It will relieve some anxiety. They have been in 10 months exposing themselves to virus over and over and over again. And as millions of Americans get vaccinated, we'll be able to see if there's any rare side effects. So as we move forward and down through those tiers, we'll be able to understand not only how it's going to protect our vulnerable Americans, but how it's going to protect those individuals in the front line.
How soon will we know if these vaccines prevent infection and asymptomatic spread?
A brilliant question. And I think that's the question on all of our minds that have studied immunology for so long. It is more difficult to cause what we call sterilizing immunity, to prevent any infection. It is a lot easier to prevent disease because your immune response kicks in early. And so that's why it's going to be really important to look at that. We have to really make the assumption right now that the vaccine is going to protect against disease. And until we know if it prevents against infection, we're going to have to continue to do those things that we know between mask and physical distancing, avoiding gatherings. We're going to have to continue that until we get that data.
And kind of going off of that, Dr. Vin Gupta from Harborview in Seattle said on MSNBC that after your second dose of the vaccine, that does not mean that you should be traveling or that you are liberated from wearing masks, to which Texas Senator Ted Cruz responded by saying that comment is anti-science and it's only focused on absolute government control of every aspect of our lives. Should we be listening to the doctor there after the second dose of the vaccine, or should we be listening to Texas's senator?
So, this is the distressing thing, I think, to every public health person to see how this virus has become a dividing line in what our politics and priorities are. I think we may get to the point where we have the clear science that this protects against infection. And it protects, most importantly, against transmitting the virus to others. We just don't have that data yet. So While we don't have that data, we all need to still take those precautions. Now, as we get more and more people immunized and we see what we call that R1, that replication rate, the ability of that virus to transmit, when we see that coming down due to vaccination, not just decrease hospitalizations, but decrease fatalities, but actually decrease cases, we'll be able to really say that these vaccines, as we get close to herd immunity, are actually protecting the population from transmitting the virus to others. We're not there yet. We will get there. It's just going to take us a matter of weeks to months.
Last few questions for you, Dr. Birx. As we near the end of this very challenging year, when you look back, do you have any regrets? And how do you think history will remember the work of you and your team?
Well, I think the good news is there will be a permanent record because obviously I evaluated the data every single day and wrote an analysis of my understanding of the virus, but also my understanding of communities and how communities were reacting to the public health messaging and how we had to adapt our message so that people could hear it and understand it. I think in looking back, really understanding how our messaging was perceived. When I started going out the end of June, I went out because of that. There's always two sides of public health. There's health, and it's all the science and the data and the guidelines. And there's public, how the public hears those guidelines, how they internalize those guidelines, how they change their behaviors or not based on those guidelines. And people hear things differently until you go and listen to them and actually hear them. You can't really modify your message. So if I was going to do things differently, I would have gone out earlier. As soon as the lockdown was over, to understand decisions that states were making, that communities were making, and understanding how to be more effective in consistent messaging.
And Dr. Birx, I know you've addressed it the last few days, but your post-Thanksgiving travel was brought up in the headlines this weekend, and the travel of other leaders across this country has been brought up in the headlines as well. Do you fear that travel from leaders in political positions, those we trust to lead us through this virus, is impacting the trust that Americans are placing in people like you?
First and foremost, my Thanksgiving was not a Thanksgiving that I've ever experienced in my 60 some years. This was only my immediate household. It was a regular dinner. To give my daughter, who's 32 weeks pregnant, we had purchased a home where we could provide additional isolation separate from everyone by vehicle, 2.5 hours away. I had no idea how people would interpret that. That was a safe house, a house where no one else was. There was no one else in there. I didn't travel by plane or train. I didn't gather with outside family members. And so, when I could see how it was being perceived, which I had obviously no idea of, because, I don't ever even take this mask off as an example to the American people about what we need to do, even indoors, to protect one another, as well as outdoors and in public spaces and our personal spaces, what we need to do to protect each other. I can promise you that over this holiday season, and as long as I'm in any leadership role, I will not be traveling even to my home, which I know you can see that a lot of public health officials travel to their second home continuously and safely, I will add. But I do not want to lead any misperceptions in the American people of what we need to do when we talk about gathering. We do not want you to gather outside of your immediate household until we can get all of our vulnerable Americans immunized. We are so close and we protected them for so long. And I think we can do it. We know now they're either in 1A, 1B, 1C. If they're vulnerable and they're older, they're going to get vaccinated. And we can put our effort into protecting them until that great day that they've gotten their second shot. And they're several weeks out from that, and we know they're protected.
And lastly, Dr. Birx, how are you feeling about timeline moving forward, and when members of the general public in America can expect that shot in the arm and their vaccination as well if they choose to get it?
I think with the projection of what the companies are making and their ability to check their sterility and release, obviously, the vaccines are produced and then they're put in vials, and then you've got to make sure that they're sterile and that everything's perfect with that vaccine, and then they're released to the American people. And that projection really shows that we can get through these frontline healthcare workers, our long-term care facilities, our individuals over 75 and then over 65, and those with comorbidities, and those frontline essential workers. We can get through those particular tiers through December, January, February, March. And then there really is the question when people ask me about all Americans, we haven't even studied yet the under 18s or the under 16s and really understanding the efficacy of the vaccine there and the safety profile there. So that's work we still need to do. And that will probably take us through the spring and the summer to really understand and get to what Americans would perceive as all Americans vaccinated.
Dr. Birx, thank you for your time. Have a Merry Christmas.
Happy holidays.
Thank you very much.